Today in this video, we're going to cover the practical approach to using open dental treatment plans so that your treatment plans are easy not only for your team, but also for your patients. We'll talk about how to make financial presentations simpler for your team so that it's easier for your patients to understand when they're thinking about moving forward with treatment. But I didn't stop at just using it. I learned it to a point where I developed my own software on top of Open Dental called Teamio, which is now helping hundreds of other practices optimize their business operations and keeps them on the pulse of their financial performance. These aren't just theoretical tips. These are battle-tested shortcuts and workflows that I've learned from making mistakes in the last decade of using Open Dental inside out. If you're new to this channel, my name is Neil Shah. This is where I share what I'm doing in my dental practice, running the everyday business operations. I share with you what's working, what's not working, and to stay updated on this type of content, join our free newsletter over at dentalstartupacademy.com, and I will share the link below this video for those of you who believe in taking action. Let's get started. In part one of this two-part series of videos on open dental treatment plans, we went over how to enter treatment into the patient's chart through the charting module. We covered best practices to save you and your team's time, and also things that you should be skipping, which I consider time wasters. So if you have not yet, I'd strongly recommend you watch that video first. So here's what we're going to cover. Number one, making treatment plans easier for your team to understand and also for your patients. We'll do this by going over how to create saved treatment plans to break up the big treatment plans into phases. We'll also talk about how to assign priorities to the procedures you're recommending to your patients, assigning treatment coordinators or case presenters to the saved treatment plan, and I'll get into why this is actually important. In the end, when I go over the weaknesses of the Open Dental Treatment Plan module, I'll get into why assigning of the priorities and the treatment coordinators actually plays an important role. Number two, making the financial presentation simpler for your team and easy to understand for your patients so they're not overwhelmed. We'll go over which columns of information you need to focus on in the treatment plan module when you're presenting treatment and finances to your patients. We'll go over how to make sure that the information you're looking at is actually a good estimate or close to an accurate estimate when you're going over patient obligation in terms of finances. We'll also talk about a common mistake that's made when we're dealing with saved treatment plans, which can actually lead to your team misquoting the patient their financial obligation. And of course, we'll go over how to avoid these mistakes. And number three, understanding the weaknesses of the Open Dental Treatment Plan module when it comes to measuring treatment presented and case acceptance. And we're gonna go over why this is actually important. All right, let's start with number one, keeping your treatment plans easy to follow, not only for your team, but also for your patients. Let's assume you've got a patient sitting in the chair and you've entered a bunch of treatment into the patient's chart. You may be doing the exam on your patient, you're calling out procedure, maybe your clinical assistant is writing things down on a piece of paper, and then she goes and enters them into the computer, which is perfectly fine. That's what I also do in my practice. Sometimes you have an alternative treatment plan. Let's say a tooth, it can be treatment plan for a root canal, post-core crown, but if it's not going to be saved, you may treatment plan for an extraction, which also means you may add an alternative treatment plan of an implant, custom abutment, and a crown. So now let's assume you finished the examination, and when you bring up the Open Dental Treatment Plan module, you see all of this treatment or the procedures you've entered for this patient's chart. It looks super overwhelming. If it's overwhelming for you, it's definitely overwhelming for the patient. So what you don't want to do is show this treatment plan as is when you or someone else in your office is presenting this treatment plan to the patient. Unless it's a really simple treatment plan where you're just bringing the patient back for one visit, you really need to organize the treatment plan by breaking it up into phases or just making it simpler for your patients to understand. Otherwise, they will get overwhelmed. And if they get overwhelmed, they'll get confused and worse, get nervous about everything and not move forward with treatment. So the goal is to simplify. And there are multiple ways to do this, and you should use whatever way that works for you and your team in your practice. And one way of doing it is to assign priorities. If you're bringing a patient back, let's say for simple restorative, some perio, crown and bridge, and if you're seeing this patient over 2 to 3 visits, you need to be assigning priorities to break up the treatment plan. What does this mean? You're basically breaking up the treatment plan by assigning priorities, meaning what's going to be done in visit number 1, visit number 2, visit number 3, etc. And I understand things don't always go as planned, But this is much better than just patient looking at a big treatment plan that just lists out a bunch of procedures and dollars at the end. When you prioritize this way, it just breaks up your treatment plan. Simple. Compare this where you see a bunch of procedures on a treatment plan to something like this where the entire treatment plan is broken up into phases with priorities. It's much easier to read and digest for the patients. And I'll show you how to edit this information so you can actually create custom priorities that is just anything besides numbers, because that's actually what comes as default with Open Dental. So now let's consider an example where you have alternative treatment options on a treatment plan. Let's say the patient has an upper left bicuspid that's missing. You've given the patient 3 options, a 3-unit fixed bridge, an implant, or even a flipper appliance, a temporary flipper appliance. Now you've got all of them listed on the treatment plan, but what you should be doing is give each one of them a priority. The option they're gonna go with should have a numbered priority, which in my practice indicates which visit I'm gonna do this in, whether it's first visit, second visit, third visit, etc. And the other 2 options should have a priority option indication as a second alternative or a third alternative, whatever you want to call it in your practice. Once the patient moves forward with one of the treatment options, the other 2 options that they did not move forward with should be marked as something like rejected. Now, I have client offices that keep these treatment options that are rejected in the treatment plan, even after the patient completes the treatment. But in my practice, usually when the patient moves forward with treatment and it completes that treatment, I go ahead and mark those alternative options deleted in the treatment plan. So I delete those from the treatment plan. And I do this regularly to keep the data clean. So how do we create these custom priorities? Let's take a look. So this is where you set up custom priorities. When you come to a patient's treatment plan, on the right side, you see something called set priority. And at the top, you'll see a numbered list, which actually comes default with Open Dental. And then at the bottom, I've created some customized ones. So let me show you how to do that. From the top navigation menu, you go to Setup, then you come down to Definitions. And then all the way towards the bottom, depending on which version of Open Dental you're using, it should be located close to that, but it'll be something called Treatment Plan Priorities. Okay, you click that, and this is where it's done. Okay, you can even set up the color. I did not change color for any of this. Okay, however, if I wanted to add, let's say, a custom priority here, let's say for 5th alternative or whatever. Let me see which one I have. Okay, I already have 4th. Let's say 5th alternative. Okay, not that I would ever create something like that, but let's show you an example. I'd click OK, and now you see it there, okay? And now when you close out of there, you would see it added to here as well. Now, if you wanted to change the order of how these appear, you could have done it from the same place. Just go back to Definitions again, go to Treatment Plan Priorities, and then you can just simply move this up however you want it to appear on the list in Treatment Plan. That's how you can change it here. Either move it up, okay, or down, however you prefer. Okay, so that's it for how you set up custom priorities. All right, let's move on to taking this a step further. Splitting the treatment plan into phases by saving treatment plans. When you have a large treatment plan, it becomes simpler for everyone if you just break up the big treatment plan into phases. It's not only simpler for you and your team who's going to be looking at these treatment plans in your office, but also easy for patients to read and digest all this information that you've given them. Let's look at an example. I've got this patient in the chair. I'm calling out procedures as I'm doing the examination. My assistant is writing things down and has now entered all the treatment into the patient's treatment plan in Open Dental. So now you've got this big treatment plan with all the procedures laid out. Now, she's not arranging anything or assigning priorities because that's my job as the dentist to decide which order the things should be done in. So here's what the treatment plan looks like right after the assistant enters all of it into the computer. So the first step is to organize and assign priorities like I discussed earlier. But you can take it a step further by splitting the treatment plan into phases. For instance, this patient has multiple missing teeth, and before starting on implants, you may be bringing the patient back for some simple restorative, maybe extracting non-restorable teeth, root canals, etc. So what you can do is from the original treatment plan, you can highlight the procedures and actually save it as a separate treatment plan with those select procedures. Let me show you an example. So now you've got this treatment plan, which you've got priorities in place, which means you've split up the treatment plan into different appointments. That's how I like to think of it. So priority 1, the first appointment, we're going to be working on some extractions and grafting. on the upper right, lower right side. Then second appointment, we're going to work on the extraction on number 14 and number 19, which is on the upper left, lower left, et cetera, et cetera. And you can split it up in any way you want. My point is to show you that there's some organization to this treatment plan, all right? So now you can take it a step further and basically create phases. So for example, if I'm doing extraction, I can actually select all of the extractions and grafting. And what I can do is I can actually click on this button called Save Treatment Plan and just call it exo/grafting. Okay, patient doesn't care for that name. This is really for us. Okay, so I'm going to click OK. And that is basically just a phase, and it only contains those procedures. You can always toggle back and forth between the active treatment plan as well as the phase, the sub-phase of that treatment plan. Okay, similar, you could do something at the bottom where I have implant placements at the bottom, implant placements, and then again, we can just call that, let's say, save treatment plan, implant, surgical, for example. And then now you've only got those 3 implant placements. Go back to the active treatment plan, and I can select all of the implant restorative procedures and create a separate treatment plan or phase that says implant restorative. All right, so it's as simple as that. And now you can toggle through each one of those. One thing you need to be careful with when you're looking at saved treatment plans is as you're moving forward with treatment on patients, sometimes things change. The tooth that you thought you could do a filling on now needs a root canal. So what you need to do is the correct tooth with the right procedure code needs to be changed, not only on the active treatment plan, but also on the saved treatment plan that had the original procedure on it. This is the mistake that can lead to your team misquoting the patient of their financial obligation. I'll get into this in detail in just a little bit when I discuss how to make financial presentations simpler for your team. All right, now let's talk about an option that so many users I speak with aren't even aware that this feature or option exists, but it's super useful. And that is assigning a treatment presenter or a treatment coordinator to a saved treatment plan. When you create a saved treatment plan, remember you can double click on that saved treatment plan to bring up this edit treatment plan window. You can actually assign who is going to be presenting that treatment plan. By default, it's going to be set to the user that's logged in. But let's assume you're the doctor who's told the patient what they need, and now you have your treatment coordinator or financial coordinator come in and do the presenting of the case to the patient in the room. You can then go ahead and set that person to be the presenter of the treatment plan. Why do this? Why is this even important? Well, if you've got multiple people who present treatment plans to your patients, like for example, you have a front desk who comes in 1 or 2 days a week, who presents cases to patients, or you may have a separate treatment coordinator who comes in on other certain days and who presents cases to patients. Well, now within Open Dental, you can assign that patient to be the presenter on the treatment plans they present. So now Open Dental will save that information for you and allow you to track certain things. Now you can pull up a report that's already built into Open Dental. However, there is a problem with it, which I'll get into in a second, and I'll also show you a solution. But I'll get to that in a minute. I just wanted to show you how you can basically assign a presenter to a saved treatment plan. Now let's talk about making financial presentations simpler for your team and easy for your patients to follow. Let's assume you've created a treatment plan, you've assigned priorities, you've split up the large treatment plan into phases like I showed you earlier, but before presenting the financials to the patients, your treatment plan should look like this. Especially if you're presenting to an insurance patient, that you want to be able to see these 2 columns, the insurance estimate as well as the patient portion, because that's ultimately what the patient cares about. What's my insurance going to cover and what's it going to cost me? When presenting a treatment plan to the patients, the most important keyword you've got to keep in mind is the word estimate. Your team is giving the patients an estimate of what the insurance is likely to cover and what the patient out-of-pocket is going to be. But before your team can actually give these patients an estimate of what the insurance is going to cover and what their out-of-pocket is going to be, I'm going to assume your team has already taken care of the following important steps. 1 is insurance verification is already done. Correct insurance verification details are entered into the patient's chart. Your insurance plan is set up correctly to be PPO percentage, to be precise, especially if you're in network, and also the correct fee schedule is set up and assigned to that insurance plan. Only if all of those things are done should you rely on anyone in your office to be able to present a close enough estimate of what the insurance is likely to cover and what they're likely to owe. If you've prioritized the treatment plan, you can also see the subtotals. And I like to show this to the patients because they can actually see what they're going to be responsible for out of pocket during each visit they come in. Everything we've discussed so far, assigning priorities, splitting the treatment plan into phases, I've done it in this order to show you how everything builds up to this step before you get ready to present finances to the patients. If you just have a big treatment plan with a list of all these procedures and the dollar amounts just listed at the bottom, the patients are gonna get confused, they're gonna get overwhelmed, and they're not paying attention to what they need or why they even need it. Their attention goes directly to the bottom dollar amount that you're showing them, and they're thinking, oh my, that's what it's gonna cost me. And when there's confusion, they don't move forward with treatment. So all that time you put in, showing them intraoral photos, x-rays, maybe you show them 3D animated videos of the procedures that you plan to do, all that work goes to waste because there's no organization in your financial presentation. By the way, if you're looking for more details on how to present finances to your patients, how to present treatment plans to your patient, or with templates, I've got exact videos that cover these specific topics, and I'll post the links to these videos below, so I'd strongly recommend you watch those. All right, let's keep going. Earlier, I mentioned that when you have a saved treatment plan and your team is making the financial presentation to the patients off of these saved treatment plans, you have to be extra careful to make sure that correct procedures are reflected on this plan. For example, when you change a procedure while you're working in the operatory, for example, let's say you've got a saved treatment plan. You're working on a patient, you're working on a filling, now you realize the patient needs a root canal. So now you have to change the procedure. You're working on that crown and you realize you can't keep going because you need to do crown lengthening. So now the treatment plan changes. So whenever there is some change, you have to be careful about how you make this change to the treatment plan, because if your team is making the financial presentation to the patient from saved treatment plans, it's going to actually lead to your team quoting the patient wrong out of pocket. Let me show you an example. When you're working with saved treatment plans, for example, I have this large treatment plan, it's already been prioritized. I've created small phases on this treatment plan. You can see above, here's the active treatment plan, and there's the other saved treatment plan, which turned this big treatment plan into phases. And I have this one phase called root canal, crown, and restorative on basically 3 different teeth, okay? So now where the mistakes happen is this. For example, patient is in the 3rd phase, let's say here, okay, and let's say the doctor is working on filling on number 12, which is an MOD composite. What happens when this filling, they're working on it, they realize that they actually need to turn it into root canal. It's turned into a root canal because the decay has gone too far. So now usually what they do, and this is how mistakes have happened, because this has happened in my office, this has happened in our client offices, and this is what happens, all right? So what now happens is the doctor working in the operatory, they'll just go ahead and put 12 and then mark it as a root canal, let's say here, all right? It's now added as a separate procedure here, for example, right? But don't forget that you've got this saved treatment plan that still indicates that, right? That has the original filling on it. So now look what happens is they go and delete the other filling, original filling that was treatment plan from the active treatment plan. So let's say I delete it, okay? I want to delete it, all right? So now it's gone, all right? And I'm going to put this as priority 3 again, because that's where it belongs, okay? And now if I go here, when the patient checks out, a lot of times what happens is the patient has already quoted the patient out of pocket as $852. Whatever got deleted from the active treatment plan does not get deleted from the saved treatment plans. So now what ends up happening is this still displays the filling on number 12 instead of the root canal, and you end up quoting the patient the wrong out of pocket. And this has happened numerous times, okay? So what you really have to do is, if you're presenting from the saved treatment plans, if your team members are presenting from the saved treatment plans, then you have to change the procedure here. And the way to do that is to delete it here, okay? And basically add that amount to the active treatment plan amount listed for the root canal, which is here, which is the patient portion. That will be the correct out-of-pocket responsibility per the patient. This is where mistakes happen. And this is the way to avoid all of this from happening, is to not present or not quote from the basically the phase treatment plans. Do not quote the patient from saved treatment plans. Just go off of the active treatment plan. Right, so we've talked about setting up treatment plans so it's easy for your team to present to your patients and easy for your patients to follow. Now let's talk about the weaknesses of the Open Dental Treatment Plan module when it comes to measuring how much you're presenting to patients and tracking case acceptance with patients. So what's the problem and why is it even important? There's actually two issues. Remember earlier I talked about how if you have a saved treatment plan, you can assign a presenter to that saved treatment plan. You can now pull up the treatment presentation statistics report that shows you data over time frame, the number of treatment plans presented, who the presenter is, the number of procedures presented. However, the data that shows under the column net treatment plan amount is not really net. And the same thing with the net scheduled amount, that is not a net number. Those are gross numbers. If I'm looking at any financial report on Open Dental, I do not care for gross numbers because I am a network with insurance plans. So I only care for net production or any net numbers because I want to take into account any write-offs and adjustments. I don't care to see that my treatment presenter presented a crown that was $1,500, which is my office fee. However, that patient has MetLife. So what I really want to see is what she presented was actually $800, which is the in-network MetLife fee for that crown procedure. So the numbers you're seeing on that report are overinflated, and that's my biggest problem with this. So let's take a look at an example. Here's a treatment plan, a very simple treatment plan for a patient with 2 crowns. And this patient happens to have insurance, and it happens to be MetLife. All right. And for these 2 crowns, I've kept it simple. It just all ceramic crowns, 2740, and the in-network fee for MetLife fee for these procedure, for individual procedure, is $892. So $892, that would include $1,784 as net production, right? So $1,784, that's just both crowns total, right? So now, what I've done is I've selected the procedure and I've already created a saved treatment plan. So here it is. I double clicked on it, and what I did was I set the presenter as Tina, who is my employee who's going to be presenting these 2 crowns. All right. So now what Open Dental allows me to do, it has this built-in report. If you go to reports, standard, it's called the treatment presentation statistics report. So I'll go ahead and click on it, and I'm going to limit it to just today's date because I don't want to mess with other numbers. So I can show you a simple example. So May 13th, and then I'm going to go ahead and select, actually I'm going to leave it on all and click OK. And give it a few seconds, and what it'll get is a report. Now let's see if I can enlarge this. Oh, here we go. Okay, so presenter, we have admin and Tina. Forget the admin because I've included a bunch of treatment plans in there. So let's look at this one. This is the one I just made in front of you. Okay, presenter is Tina, number of plans, 1, that's number of saved treatment plans. Number of procedures, 2, is the 2 crowns that I added. Now the problem is basically this here. And in fact, this says gross. Right, so these you would expect that's actually correct. $36.40. That's the gross fee for my office. The total for the 2 crowns. Now let's actually get out. I'm going to select net here, okay, and let's click OK again. Let it build up the report, and then I'm going to zoom in. Okay, actually it says net treatment plan amount. It still says $36.40. That's not net amount. Net amount I would expect to be taking into account the insurance write-off. So technically it should say $894, which is the fee, MetLife fee for each crown, times 2. So it should actually say $1,784. And it's the same exact problem with net scheduled amount. I haven't scheduled anything yet, or the patient hasn't scheduled anything, but let's take a look and see what happens, right? So let's close this out for a second. So what I've presented, what I'm trying to show you is if I'm trying to track how much treatment Tina has presented, so Tina should have been, the number that I want to see is the net fee, okay? And now I want to see how much got accepted, which means how much of whatever was presented actually got scheduled. So let's assume this patient wants to make an appointment. So I'm going to just put the appointment in for today, all right? And I will create a new appointment, and I will put it in for both of the crowns, all right? And in fact, Open Dental will actually show you the net production attached to that appointment, which happens to be $1,784 because patient has MetLife. So if you complete the production on these 2 crowns, it would equal $1,784. Now let's go back to reports, standard, and we will click on the treatment presentation statistics report, and let's leave it as net calculated production, and I'll leave everything else same, and I'll click on today's date, and let's say it's okay. Now let's enlarge this for a second. Again, net scheduled amount should not say 3640. It should say 1784. So this is the problem that I have with this built-in report. So as of now, there is no way for me to basically see how much I'm presenting or how much an individual presenter is presenting or diagnosing, whatever, or individual doctor, and actually seeing and tracking how much is getting scheduled from what we're presenting. The second problem I have is not just connected to this report, but it's connected to another report called the pending treatment report. Earlier, I mentioned that you can set up custom priorities in Open Dental. So for instance, if I have a patient with a single missing tooth and I've given that patient multiple treatment options, let's say an implant, a 3-unit fixed bridge, or maybe a partial. And let's assume the patient opts for the implant option. Now I go into Open Dental and I mark the bridge procedures as well as the partial as rejected because that's the custom priority that I've set up in Open Dental. But now the problem is when I go to the treatment presentation statistics report, it's going to count these rejected procedures, which the bridge and the partial, into its numbers for presented dollar amounts. Even though I've marked these procedures as rejected, and it really shouldn't be counted towards anything when I'm trying to track what I'm presenting to patient in terms of net dollar amounts, there's really no way to filter out by custom priority. So there's no way to filter out these rejected procedures. All right, so how is this connected to the treatment finder report or the pending treatment report? Well, when I go to the treatment finder report, the rejected items still show up and counted under the total treatment plan totals because Open Dental itself does not have a way to filter out rejected items. And so why is this important? Why is this even a problem? Well, if I've got someone in my office that's responsible for keeping my schedule productive, keeping my schedule busy, and the way she does that is by following up with patients consistently by looking at this treatment finder report, well, let's assume the patient completed the treatment that they opted for and never moved forward with treatment that was rejected, of course. When she goes to this report, she's still going to see the rejected items under that patient name. That's because Open Dental is not going to filter out these rejected items because it doesn't allow for filtering out by custom priority. Let me show you an example. All right, to show you my point, here's another example. I've set up a small treatment plan, a simple treatment plan for this patient with 2 fillings and a crown, right? And if you notice, the fee, which is the gross fee for all 3 total procedures, totals $27.08. All right, so now let's pull up the pending treatment report. So if I go to report standard, and in fact, it's called the treatment finder report in Open Dental. So treatment finder. All right, I'm gonna just sort it by last name because I know the patient's last name. I'm just gonna go down to where I can find that patient. Here it is, Lazar Jennifer. If I go all the way to the right, I can see treatment plan 2708, which is the gross fee for the 3 procedures that I treatment plan. Well, that's one problem right there, that I have no way to see the net numbers on here. It only shows me the gross treatment plan amount. So I don't have a way to see if this patient has insurance. I don't have a way to see the net dollar amounts for net treatment plan. Okay, so that's one problem. If I cancel it out, let's close it out. So now let's go ahead and let's say the patient has actually rejected the crown option on tooth number 14. All right, so I'm gonna go ahead on this custom priority that I've created on the right side, and I'm going to mark it as rejected. Okay, so I'm going to keep it down here. So I know the patient is only moving forward with the 2 fillings. Okay, so now if I go ahead back to the report and then click the treatment finder report again, let's sort it again. And if I go down to the patient, let's see, Lazar, right there. Again, nothing has changed, right? Treatment plan, the gross fee still says $27.08. Why? Because there's absolutely no way for me to basically filter out that priority of rejected. Of course, the rejected priority is a custom priority that I created, but there should have been a way to filter that out. And why is this so important? As I mentioned earlier already, that if I have a team who is assigned to follow up with patients for unscheduled treatment, but there's treatment that is marked as rejected or not to be followed up on, well, then it shouldn't be counted on this list, because if that's the only treatment that's left on the treatment plan, it's going to show up on this list for them to call, and that's not right. And so that's the point I wanted to get across, because there's no way to filter out rejected treatment. Basically, there's no way to filter by treatment priority, and I don't want to see on this list patients that have treatment that I've marked as rejected. All right, so I've gone over the 2 problems with the Open Dental treatment plan module when it comes to measuring what you're presenting to patients and trying to track what's getting accepted. So what's the solution? Well, there are two solutions to the two problems that I mentioned. One is to filter out the rejected treatment when it comes to tracking how much you're presenting to patients. And the second solution is also being able to filter out rejected treatment so you can leave patients out when your team is trying to pull up patients to follow up for unscheduled treatment. So here's how I do this in my practice and how we train all of our client offices using Open Dental. Let's start with the first solution, which is our treatment presented versus accepted report. All right, so here I am on the dashboard on Teamio for treatment presented versus accepted. This screen pretty much gives me a big picture on exactly what's happening in my practice. Just to give you a very brief overview, you're looking at a specific time frame. For example, when you load this dashboard, it comes to month to date. So from May 1st to the present date, it gives you all of this data. So for example, treatment plan total. What's the net dollar amount I have treatment planned or presented to the patients and how many procedures? When you load it, remember there's no filters applied here. So I'm only the provider in the office, but if you have 3 other providers, associates, hygienists, it will all be listed here. It will give you the total net dollars presented by the total of the providers as well as the total procedures, and it'll give you the breakdown by each provider just right below it. On the right side you see scheduled total, so which means anything you've treatment planned from this time frame to May 16th, how much of that is actually scheduled as of the present date and how much is actually completed. And the total of these two is what's referred to as accepted. So you have treatment presented, which you've diagnosed, presented to the patient, and versus accepted, which is the total of scheduled and completed dollar amounts. All right. Now, instead of giving you a whole tour of this, I want to focus on the idea of this video for this segment where we're talking about how to leave out rejected treatment options that you may have put into the treatment plan. Now, let's go back to Open Dental. I've created a very simple treatment plan here for a patient. And you can see the patient is myself. I have included 2 crowns. Okay. So if I go back and this patient has Aetna insurance, and the in-network fee for the procedure, which is Crown 2740, is about $936. So $936, and 2 of those, which means total $1,872. So if I were to go back and I take this time frame and just include the present day, which means show me only data from today. And if I hit apply filters, now I see the net dollar amount of $1,872. I can see that only 2 procedures have been treatment planned as of today by Dr. Shah. All right, and you can see that at the bottom, the only thing you see is Crown and Bridge category procedures of $1,872. So it's showing you the net dollar amount. Of course, nothing is scheduled as of yet, and nothing is completed, so it's showing you 0. All right, now let's go back to Open Dental for a second. I'm going to add in, let's say, a root canal for this tooth, for example. Let's just go here, RCT molar. All right, and I'm also going to just for kicks and to show you the example, plan an alternative treatment option if you can't save this tooth, or we're not going to save this tooth, is an implant placement. I'm not going to put in all the restorative treatment, just let's look at the placement because I just want to get the point across. And if I go back to treatment plan, I can see that, all right, the root canal is added, the implant placement is added, all right, and basically the $1,534 is the implant in-network fee. So if I go back here and keeping the time frame as today's date and hit apply filter, that amount just got updated. You can see that. Now there's total 4 procedures that I treatment planned, Dr. Shah, and then it says basically implants, total net dollars in implant category was $1,534, total net dollars in Crown and Bridge was $1,872, and the total of endodontic treatment that was treatment planned today was $773, which are the exact Aetna fee for those procedures, treatment plan. Remember, I'm looking at the office totals. If you have multiple providers who did this in the present day, it'll break it down for who treatment planned what in exact category and the total dollar net amounts. All right. So now let's go back to Open Dental. Now what I'm going to do is mark this as basically a rejected treatment. So implant placement, let's assume we are going to save this tooth, and I'm going to mark this as rejected. Implant placement, I'm going to click on the custom priority as rejected, and I'm going to mark the root canal as the thing that we're going to do in the second visit. Now, if I go back to my dashboard, if I just hit apply filters, nothing changes because I haven't included any filtering up top. But now I don't want to see the rejected option because I'm trying to see what I've presented today. So I'm just going to go to the option of filter by treatment priorities. And my priorities are either 1, 2, or 3. That's all I want to see for today. And then if I hit apply filters, now the number is less. You can see the procedure count went down by 1, which is the implant that we marked as rejected. You can see at the bottom now the only procedures that show are the endo procedure, which is the molar root canal, the 773, and the crown and bridge that was there before, and you see the dollar amount. So I just wanted to show you this on how you can leave out rejected treatment, okay? And of course, you could have marked it not just as rejected, you could have marked it as second alternative, third alternative option in custom priority if you're treatment planning like a flipper appliance or denture appliance, etc. And so what this really does for you, it gives you basically the real numbers. You can leave out things that you don't want counted when you're trying to measure what you're diagnosing versus what's getting accepted or scheduled. All right, I hope that helps. All right, now let's show you the second solution, which is Teamio's unscheduled list, which has lots of different custom filtering built in, including filtering by custom priority that we've discussed in this video. So what you're looking at on the screen is our unscheduled treatment capability of Teamio, and basically it'll give you a whole list of all the patients with pending treatment, okay? And again, instead of giving you a full tour of what you're looking at on the screen, I just wanna get to the point of the video where I wanna show you how you can exclude treatment that you marked as rejected so the patients don't show up on this unscheduled treatment list. And in fact, I'm gonna use the same treatment plan that we just did for myself as the patient. So remember, going back to Open Dental, I have 2 crowns and a root canal, and then an implant placement, which is a rejected option, okay? So now, as is, if I go here, and remember, the crowns and the root canal are basically not scheduled yet, so they're still unscheduled. So if I refresh this page, and if I'm pulling up the unscheduled treatment report, well, that patient is just gonna show up at the top. Why? Because I just saw them, okay? And it's real-time data, so if I were to click on it, this patient has pending treatment, so if I go to unscheduled treatment, I'm going to see the 2 crowns, the endo, and the surgical placement implant, along with this listed priority, 1, 2, and then here it says rejected. Now, however, if I just go to the top, there's lots of filtering capability you can do here. You can filter by codes, like if you want to pull up implants and such. But here we're talking about filtering by priority. So I want to exclude anything that is rejected, right? However, if I hit apply, I still see myself, the patient, on the list. Why is that? Well, technically, the other 3 treatment are still on the list, right? And they're not completed. So, and hopefully that makes sense, right? One of the procedures marked rejected, but there's still 3 active procedures on the treatment plan that are not scheduled. That's why the patient shows up on the list. Now, let's go back to Open Dental for a second. Let's assume the 2 crowns are completed. And for now, instead of scheduling an appointment, I'm just going to delete the procedure. Okay, delete. I'm going to mark this delete. Let's assume this is completed. All right, and I'm going to mark this delete. So I've deleted all basically procedure except for the implant placement procedure. So now if I go here without this filtering on, I'm gonna just hit refresh for a second. The patient is on the list still. Okay, you can see that patient here. But if I click on it, if I go to unscheduled treatment, you can see the only procedure is the rejected option. So now I don't want to see any patients who have on their treatment plan any procedures that are marked or as rejected, and those are the only procedures I have. So I actually want to exclude this patient. So now I can go to exclude, and I don't want to see basically rejected treatment options, apply, and then the patient no longer shows up. That's exactly what we want, because I don't want my team to see that patient is supposed to be called, because they're not. They've completed all their procedures on their treatment plan. There's nothing left on the treatment plan except for rejected procedures. Right? So I hope that makes sense. And there's lots of filtering that you can do here. If you'd like a one-on-one demo with me to see how I'm using Teamio every day with Open Dental in my practice, as well as all the other offices are using it every day in their practices, click the link below this video to schedule the demo, and I'll take you behind the scenes of how we're tackling some of the issues we've discussed in this video with Teamio and Open Dental. All right, that's all I have for you today on Open Dental treatment plans. I hope that was helpful, and until next time, take care.